Ben is one of my patients who just recently had a procedure done. And during our interview today, he is going to share his journey regarding what he went through with his urinary difficulties. So, Ben, tell us, you're a 63-year-old young guy. Tell us what happened before you came into the office here.
Yeah, for several years, progressively the urination got worse, and I think I delayed getting the repair or surgery because of fears about you know the catheter and recovery and other things. And I just wish I would have done it sooner. Is all I can
So,
say.
when you first came in, were you taking medication?
N- Not daily, no,
Yeah,
I
you,
wasn't.
you, you were not very compliant with medication.
No, I was not. The only thing I took was a vitamin that you told me to take, and I was taking that, and I think that was more for the score than it was for helping in a urinary. And I didn't
I,
want
I
to take the the medication that helped with the flow. I was resistant.
tamsulosin.
Yeah, yeah, I didn't want to do that. So,
So you were prescribed that medication. I know I prescribed
yeah.
that for you. You were not very good at taking it. And then what else happened?
What
What
else?
kind of workup did we do?
Um, I'm sorry, the workup.
Yeah, what procedures did we do to
Oh,
evaluate your urinary troubles?
um, to evaluate, at one point you did a, a catheter to view it, and you talked about there's a couple of different types of repairs. One is I think it's called a Urolift, and the other is a TURP procedure. So you did that evaluation to determine what was the best
Yeah,
approach.
we looked
Yeah,
inside your bladder and
yeah,
your urethra, looked through the
yeah.
prostate.
Right.
And do you recall what we saw?
Not really, because I was not the happiest camper at the time. So I think my eyes were closed tight, and I didn't look. I think you told me that it was protruding into the bladder, and so I was not a good candidate for the Eurolift. So we had to do the TURP procedure.
Yeah. So you had what we call a large median lobe that was
Okay.
growing into the
Yeah.
bladder,
Yeah.
and I tried to show it to you as I was doing
Yes.
the
Yes.
procedure, but I don't think you want to see it. I
No.
didn't think you were up to seeing the
No.
actual obstruction,
No.
but you had that blockage, which made you a poor candidate for a minimally invasive procedure, and we ended up deciding to have a TURP done, which
Yeah.
you had several
Yeah.
months ago.
Yeah.
How was your recovery from that procedure?
It was quite easy. I had a catheter for less than 24 hours, and or I think it's called a catheter, right? The catheter for less than 24 hours. I came in, we removed that, and after that was removed, it was just it was great. Little bit of post surgery blood for a little while, but nothing else. It was great after that. So
And did you have the procedure in a hospital, in a surgery center? And did you have to stay in the hospital afterwards?
no, it was a surgery center, and I think the surgery was maybe an hour and a half, and then I was released to go home. So
You didn't have to stay in the hospital.
no, no, I did not have to stay in a hospital at all.
Something that is very worrisome for a lot of guys is sexual side effects after this TURP procedure. Would you address that a little bit?
Yeah, I did some research on that online, and it's pretty rare. I was a little bit worried about that, but I think I was more worried about just the surgery, the unknowns of the surgery itself, and just having the recovery time. I think those were more my worries, but it didn't impact. I mean, it was a very light recovery and hasn't impacted anything else. So.
Sounds like you were saying it hasn't impacted negatively your sexual function.
No, not at all. No.
How has undergoing this surgery changed your quality of life?
It's made it a lot better. I wish I would have done it sooner. I mean, I would say maybe a day or two after the surgery, I actually said that, and I think I put that on your website as well. I think I put that there. You go from going into a Costco, and the first thing you think of is I've got to go to the bathroom before I can even shop, and then going to the bathroom before you can go home. And you put up with that for an extended period of time, or at least I did, because of those fears. So now I don't have any of those. So it's I would say it's back to normal. So
Wow, that's impressive. And it sounds like what you're saying is that before the surgery, your life revolved around where the
it
bathrooms
did.
are.
It did. It revolved around where the bathrooms were, and I usually drink water before I go to bed and during the night. That was causing me to get up probably 2 to 3 times a night, uh, minimum. And you're right. Life revolved around where's the next bathroom. Every bathroom was an opportunity. Right.
What about now? When you go to bed, how many times do you have to get up at night? You were getting up two to three
Yeah.
times before
Yeah.
surgery. What about now?
I would say 0 to 1 time a night. And I think that's because I make sure I'm hydrated, probably overhydrated. And it's okay to get up once a night for me because I would rather be hydrated. So.
Now, you're still a young guy, you're still working, and I think you said something about your coworkers. What were you telling your coworkers?
Well, it's pretty obvious when someone is having these struggles, right? It's, hey, we're going to lunch. Let me go to the bathroom first. Getting back from lunch, I'll be right back. I've got to go to the bathroom.
Wow.
Well, I've told a couple of coworkers about this, and they both had the same concern. How does it impact sexual life? And I'm not a doctor, so they probably shouldn't listen to me, but I told them to come talk to you. So, and I told them, don't worry about it, right? So,
Well, you have your experience to
yeah,
go by.
yeah, my experience, yeah.
Yeah.
So,
And for someone who does a lot of these procedures, I will tell you the experience of the surgeon matters. And
yeah.
you had mentioned that you knew of two other people who went through the same procedure right around the time you went through the procedure. What were their experiences like?
Yeah, and one of them lives in Mesa and one lives in Phoenix, and they both had to have the catheter much longer, and one of them had some complications. He didn't tell me what they were, but their experience was very different than mine.
Yeah.
So,
Of course, some of it is, I can do the best work that I can try to do, but then sometimes it's
yeah,
the guy
yeah,
upstairs
yeah, and
causing
everybody's
things.
different. Yeah.
Yeah, but your experience is very typical. Having an outpatient procedure and having to wear a catheter for less than 24 hours.
Yeah, and that was critical for me. I mean, it's no fun, and I can't imagine doing it any longer. But I mean, if you had to, you would deal with it. But I appreciate the fact that it was less than 24 hours. So,
Well, very good. What would you tell folks who are on the fence regarding getting their urination problems evaluated?
I would say get in to see you and
I
and
appreciate it.
and get whatever procedure done that you need to get done. Just get it over with. So,
Well, thank you so much for sharing your story.
well, thanks.